10 common signs of poor blood circulation that you should not ignore. Poor blood circulation is a silent threat to our overall health, but it is often ignored until it causes serious problems. Blood circulation is the process by which blood flows around the body, delivering essential nutrients and oxygen to cells, and removing waste products. When circulation is compromised, it can have a profound impact on your well-being. Many people suffer from poor blood circulation, even without noticing the signs their body gives. In this video, we'll explore 10 common signs of poor blood circulation, and why it's crucial to be aware of them. Cold hands and feet. Poor blood circulation can manifest itself in cold extremities, such as cold hands and feet. When blood circulation is compromised, your body may prioritize sending blood to vital organs, such as the heart and brain, while neglecting the extremities. As a result, the fingers and toes receive less blood, causing a cold sensation. Coldness is often due to vasoconstriction, a process in which blood vessels in the extremities narrow in response to reduced blood flow. This narrowing reduces the amount of warm blood reaching these areas. Additionally, decreased circulation can result in a lack of oxygen and nutrients, which are essential for maintaining a comfortable temperature in the legs and hands. Cold hands and feet should not be considered just a response to cold weather. If you experience this sensation frequently, it is important to see a healthcare professional for a full evaluation and diagnosis. Ignoring the symptom can lead to complications, as poor circulation is often an underlying factor in several health problems. Varicose veins. Varicose veins are enlarged, twisted veins that often appear on the legs. They can be unsightly and painful. These veins are typically associated with poor blood circulation in the legs. When the valves in the veins don't work properly, blood can pool in the veins, causing them to become swollen and visible on the surface of the skin. The circulatory system relies on one-way valves in the veins to prevent blood from flowing backwards. When these valves become weakened or damaged, as is often the case with venous insufficiency, blood can pool in the veins, leading to the development of varicose veins. Varicose veins can cause discomfort, pain and a heavy feeling in the legs. Although varicose veins are not always a medical emergency, they can negatively affect your quality of life. If you experience pain, discomfort or self-esteem issues due to varicose veins, it is best to consult a healthcare professional. They can offer several treatment options, including lifestyle changes, even using compression stockings or medical procedures, to resolve the problem. Erectile dysfunction. Erectile dysfunction, ED, can be related to circulatory problems, especially in adult men. Healthy blood flow is essential for achieving and maintaining an ideal erection during intercourse. When blood circulation is compromised, it can affect the ability to achieve or maintain an erection, potentially leading to ED. Erectile dysfunction usually occurs as a result of problems with blood vessels, particularly in the pelvic region. When these vessels do not dilate or expand adequately to allow increased blood flow to the penis during sexual arousal, achieving and maintaining an erection can be challenging. It's important to note that erectile dysfunction can have a variety of causes, including psychological factors, hormonal imbalances, and medical conditions. If you have persistent difficulty achieving or maintaining an erection, consult a healthcare professional for a comprehensive evaluation to identify the underlying cause and explore treatment options. Numbness and tingling. Numbness and tingling sensations, also known as paresthesia, can occur in various parts of the body, including hands, feet, arms, and legs. These sensations often indicate that blood circulation may be compromised, resulting in reduced oxygen supply to nerve cells. Poor circulation can cause nerve damage, and is commonly associated with diseases such as diabetes. In diabetes, high blood sugar levels can damage blood vessels and nerves. This damage affects the nerve's ability to transmit signals, causing numbness, tingling, and loss of sensation. Prolonged poor circulation can cause serious complications, such as diabetic neuropathy, which can cause chronic pain and loss of function in affected areas. If you experience numbness and tingling regularly, it is essential to seek medical attention to determine the underlying cause. Early diagnosis and proper management can help prevent further nerve damage and improve your overall quality of life. Swelling in the limbs. Swelling in the legs, ankles and feet, known as edema, is a sign closely linked to circulatory problems. Proper blood circulation plays a critical role in maintaining fluid balance in the body. When blood flow is compromised, fluid can accumulate in the extremities of the legs, causing swelling. Edema can result from several factors, including deep vein thrombosis (DVT), heart failure, and varicose veins. Deep vein thrombosis occurs when a blood clot forms in a deep vein, usually in the legs. This clot can partially or completely block blood flow, causing localized swelling and discomfort. In more serious cases, the clot can break free and travel to the lungs, causing a potentially fatal condition known as pulmonary embolism. Heart failure, on the other hand, weakens the heart's ability to pump blood effectively. This can lead to a buildup of blood in the veins, causing fluid to leak into the surrounding tissues, resulting in swelling in the legs and ankles. While mild edema can sometimes be attributed to temporary factors, such as prolonged sitting or standing, persistent or severe swelling should not be ignored. It is important to consult a healthcare professional to rule out serious underlying conditions and ensure appropriate treatment. Slow healing wounds. Proper blood circulation plays a vital role in the body's ability to heal wounds. When blood flow is compromised, whether due to circulatory conditions or other factors, it can lead to delayed wound healing. This can be particularly concerning because wounds that don't heal properly can become vulnerable to infection. Reduced blood flow impairs the body's natural healing processes. Inadequate oxygen and nutrient delivery to the wounded area slows down the formation of new tissue and the removal of dead or damaged cells. As a result, even minor cuts, bruises, or sores can take longer to heal than usual. If you notice that your wounds are healing slowly, or that you have recurring skin problems, it's crucial to address the issue promptly. Consult with a healthcare professional who can help you determine the underlying cause and recommend appropriate treatments to improve your circulation and promote effective wound healing. Muscle cramps. Muscle cramps, commonly referred to as Charlie horses, can be another indicator of poor circulation. When muscles don't receive an adequate supply of oxygen and nutrients, they can cramp and spasm. Dehydration is one factor that can contribute to muscle cramps, but circulatory issues can also play a role. Inadequate blood flow to muscles can lead to oxygen and nutrient deprivation, causing muscle fibers to contract involuntarily and intensely. These cramps can be painful and disruptive, making simple tasks like walking or climbing stairs uncomfortable. To alleviate muscle cramps related to poor circulation, it's important to stay well hydrated and maintain healthy circulation through regular exercise. Stretching and gentle massage can also help relax cramped muscles and provide relief. Fatigue and weakness. Persistent fatigue and muscle weakness can be connected to poor blood circulation. When your muscles do not receive an adequate supply of oxygen and nutrients due to circulatory problems, they can become easily fatigued, impacting your overall physical performance and energy levels. Chronic venous insufficiency, which leads to blood pooling in the legs, can be a source of muscle fatigue and discomfort. Inadequate blood flow to the muscles can affect their ability to perform optimally, causing sensations of heaviness and weakness, especially during periods of physical activity. Peripheral artery disease (PAD) is another condition that can contribute to muscle weakness. It is characterized by narrowed arteries in the extremities, reducing blood flow. As a result, the muscles do not receive the necessary oxygen and nutrients, leading to symptoms like cramping and fatigue, particularly during exercise. Managing these symptoms often involves addressing the underlying circulatory issues through lifestyle modifications, medications, and, in some cases, surgical interventions to improve blood flow to the affected areas. Cognitive issues. Blood flow to the brain is vital for maintaining cognitive function. Reduced blood circulation to the brain can lead to cognitive issues, including memory problems, difficulty concentrating, and mental fatigue. Conditions like atherosclerosis, which narrows the arteries and restricts blood flow, can impact brain health. Atherosclerosis is a systemic condition where fatty deposits, cholesterol, and other substances accumulate in the walls of arteries, causing them to narrow and harden. This condition can affect not only the arteries in the heart, but also those supplying the brain. Reduced brain blood flow can lead to cognitive challenges, including cognitive decline over time. In some cases, decreased blood flow to the brain can lead to more serious issues, including strokes or mini-strokes, transient ischemic attacks. These events can result in sudden cognitive deficits, and require immediate medical attention. It's vital to recognize cognitive changes, and seek medical evaluation to determine their cause, as early intervention can significantly impact outcomes. Managing conditions like atherosclerosis through lifestyle changes, medication, or surgical interventions can help maintain cognitive function. Chest pain. Chest pain is a symptom that should never be ignored. It can be a sign of serious cardiovascular issues, including angina and heart attacks. These conditions are often linked to poor blood circulation, which can result in reduced oxygen delivery to the heart muscle. Angina, characterized by chest pain or discomfort, occurs when the heart doesn't receive enough oxygen-rich blood due to narrowed coronary arteries. It is a warning sign of potential heart problems. A heart attack, on the other hand, happens when a coronary artery becomes completely blocked, cutting off blood flow to a portion of the heart. This is a medical emergency, and immediate treatment is critical. It's crucial not to ignore chest pain, as it can be indicative of heart disease or a heart attack. If you experience chest pain, especially if it is associated with other symptoms like shortness of breath, dizziness, or pain radiating down the arm, seek immediate medical attention. Poor blood circulation is a health issue that can have far-reaching effects on your overall well-being. Recognizing the signs and symptoms is the first step in addressing the problem. While these 10 common signs may not always indicate circulatory problems, they are essential to be aware of. If you suspect that you have poor blood circulation, it's crucial to consult with a healthcare professional for a proper diagnosis and personalized treatment plan. By taking steps to improve your circulation and address underlying issues, you can enhance your quality of life and reduce the risk of complications associated with circulatory problems. I trust that you enjoyed the content, and click on the like button, subscribe to the channel, enable notifications, and share the video with your friends and family.